Welcome to everyone. This is the meeting for the presentation of European Manifesto for Healthy Longevity that was published by SALUS Network. We are here because we want to show some specific proposal that SALUS Network want to share with the new European Parliament. And so this is the moment to present this proposal to every candidates that are running to the European election for the 9th of June. And so we are here with some speakers that can help us to know better and deeply this kind of proposal. First of all, I would like to share with you some general information about SALUS initiative. Okay, SALUS originates from an intentional community located in the northern of Italy, and it is in the countryside nearby Milan, and it is a special intentional community that is currently inhabited by around 60 persons, and the particularity is that they base their lifestyles on daily practice like nutrition, healthy nutrition, physical activity, and deep relationships. So these are the main aims of SALUS initiative, and started from this concrete experience, a human experience in Italy. So this eco-village is like a tangible living testimony of this of the beneficial effect of these daily practices. And it's linked also with the practice of traditional medicine, like Chinese, Ayurvedic, and European and Mediterranean traditional medicine. This initiative started in 2019, starting from an idea of naturopath Milena Simeoni, and it aims to put at the center of the public debate health promotion and environmental sustainability. And we started in 2019, in April of 2019, in the European Parliament of Brussels with a first international event. And then after this event, it started also a network that now count around 35 organizations, profit and non-profit in eight European countries. And also has a help from a philosophical and scientific point of view from a specific committee. You can see this expert of international level that help us in organizing our events, our international events in European Parliament and in other nations. And in December of 2019, with MEP Eleonora Evi, started also an interest group that was established in order to support SALUS initiative. And now this interest group is composed by Rosa D'Amato, Tilly Metz, Patrizia Toia, Manuela Ripa, Sirpa Pietikainen, Elisabetta Gualmini, Paola Guidoni, Carlo Fidanza, and Michel Rivazic, that unfortunately passed away last year. But now I would like to leave the floor to MEP Rosa D'Amato, that is the president of interest group SALUS.
Thank you, Federico. I joined the SALUS initiative from its inception in 2019, taking over as chair of the SALUS interest group in 2022 from outgoing colleague Eleonora Evi. The Friends of the International Lumen Foundation, who coordinated the European SALUS network, bring a very clear message that I share deeply. We must put health promotion at the center of the debate. I mean health with a broad meaning that holds together humans, animals, and the environment. Health promotion has been talked about for years, since the establishment of the WHO in 1946, and even more so since the first International Conference on Health Promotion held in Ottawa in 1986. Unfortunately, health promotion is still talked about little and often in a superficial way, putting in place actions that prove to be ineffective. The results are there for all to see. In Europe, at the beginning of 2018, there were 100 million people aged 65 and over. This was equivalent to nearly 1/5 of the total population. In 2050, the number of elderly people in the European Union is expected to reach a peak of 100.5 million. The lengthening of life is certainly a success, but it must be accompanied by a good quality of life. The data emerging from the global burden of disease and from Eurostat are not comforting. Healthy life expectancy is increasing more slowly than life expectancy. In other words, as life expectancy increases, so does the expectation of years lived in disability. The increased social, economic, human, and environmental costs create a self-sustaining vicious circle. This phenomenon is closely linked to the lifestyles and the quality of the environment in which we live, factors which in recent decades have been decisive in increasing the incidence of non-communicable disease and, therefore, in reducing the quality of life, especially as we age. On the other hand, it has been observed that 20% of centenarians do not contract any chronic disease before the age of 100, and therefore it is possible to live a long life without getting sick. But how is it possible? Which steps can be done by politicians? The European Manifesto for Healthy Longevity that we are launching today tries to give answers to these questions by making proposals that can be taken up by the European Parliament, national parliaments, and the local institutions that have competence in health issues. This is the reason why, as a candidate in the upcoming European election, I have decided to endorse the Manifesto's proposal that is very important because I invite all my colleagues who are running for office to do the same. We believe that this model of life is no longer sustainable and a paradigm shift is necessary and urgent. As a united European community, we can build an alliance that promotes healthy longevity through effective health promotion and environmental sustainability strategies. And the time is now.
Thank you so much, Rosa. Now I would like to leave the floor to another member of this interest group that joined the interest group recently, last November, MEP Elisabetta Gualmini.
Yes. Hello to everyone. I'm Elisabetta Gualmini. I'm a supporter of and a member of the SALUS interest group. And I hope, of course, if I am elected again at the European Parliament, to be still a member of an interest group like the one of SALUS. I have read very carefully the manifesto written by SALUS, which is a sort of a mandate for the new European MEPs, and the focus on healthy longevity is absolutely an utmost priority. And of course, we know that the demographic dynamics of the European countries are changing a lot. Aging is growing exponentially. And of course, it is also a very good news because if we age in an active way, in a healthy way. Of course, we can have a very active life. We can be active in the community and do a lot of things. I would like to focus on two elements which are very, very important for the challenge of healthy longevity. The first one is the vulnerability of the health system and the necessity to have stronger health systems. And in order to have this, we need the European Union. So up to now, the European Union has not a lot of competencies in terms of health policies. But after the pandemics, something has changed in terms of prevention and of course, of the well-being of the population. And now we need, in the next mandate, to focus more on health competencies at the European level and to put financial resources in order to protect universalistic health system, so that all the people, and especially the elderly, have access to the social services and health services they need. Because the universalistic system is, for instance, in Italy, very much under discussion and under challenge. And so we need to grant the elderly exactly the health protection that they need. The second element, very much important, which was also underlined in the manifesto, is the connection between the sustainability, the environmental sustainability, and the healthy longevity. So we need, all the human beings need to live in a good environment, in a sustainable environment. And here we have to speak about quality food, food necessary and of high quality. We have to speak about the traditional medicine. We have to adopt an holistic approach to the well-being of all the human beings, and especially the elderly. So, as far as I am concerned, I will be with SALUS in the next challenges. Thank you.
Okay, thank you. Thank you so much, Rosa D'Amato. Thank you so much, Elisabetta Gualmini. I know that you are very busy as other candidates in these elections, in these campaigns. And so thank you especially for the time that you have found to be here and to explain to other candidates the importance to support this initiative. And now I would like to leave the floor to another expert, Amarasca Sparagna. She will speak on behalf of Milena Simeoni that can be here. And so she will go deeply on the detail of what is SALUS, what are the principles of SALUS, in order to explain what are the special messages that we would like to share with candidates and also with organizations that would like to support SALUS. So I leave the floor to Amarasca Sparagna.
Thank you very much, Federico. Very grateful to be here today on behalf of Milena. Today, my speech aims to encourage more and more politicians to support the SALUS project for the development of concrete actions essential to the well-being of the unbreakable bond between man and the environment. Today, more than ever, we need a paradigm shift that the European SALUS project has been proposing since its first step in 2018. A paradigm shift that allows to put health in the widest sense of the word at the center of our attention. A paradigm shift that proposes a new way to solve old problems. In this regard, Richard Horton, editor of The Lancet, wrote in September 2020, "We have viewed the cause of this crisis as an infectious disease. All of our interventions have focused on cutting lines of viral transmissions, thereby controlling the spread of the pathogen. But what we've learned so far tells us that the story of COVID-19, it is not so simple. Two categories of disease are interacting within specific population: infection with severe acute SARS-CoV-2 and an array of non-communicable diseases. COVID-19 is not a pandemic, it's a syndemic. A more nuanced approach is needed if we are to protect our health the health of our communities. In the case of COVID-19, attacking non-communicable diseases will be a prerequisite for successful containment. As Singer and colleagues wrote in 2017, a syndemic approach provides a very different orientation to clinical medicine on public health, by showing how an integrated approach to understanding and treating diseases can be far more successful than simply controlling epidemic disease or treating individual patients. The economic crisis that is advancing toward us will not be solved by a drug or a vaccine. Nothing less than national revival is needed. Approaching COVID-19 as a syndemic will invite a larger vision, one encompassing education, employment, housing, food, and environment. Viewing COVID-19 only as a pandemic excludes such a broader but necessary prospectus. However, what are the beliefs of the current paradigm? Are the individual and environment interdependent entity, or are they two separate parts? Is the problem whether individual, social, environmental, generated by the whole or only by the part that manifests it? Is the problem only disturbance to be suppressed, or also a valuable informant? In order to answer this question, it is essential to take a step back. Are humans and the environment simple, complicated, or complex systems? The study of etymology comes to our aid. The term complex, from Latin complexere, woven together, clearly differs from complicated, from the Latin complicare, with folds, and from the simple, from the Latin sine plico, without folds. Complex systems are more difficult to unfold, precisely because their parts are braided together and interdependent. They are not reducible. They do not show a linear relationship of cause-effect. They are scarcely predictable and cannot be repeated. Indeed, the whole is more than the sum of the parts. Man and environment are complex systems, and to be understood, they need adequate interpretative models, little used by the current paradigm. Science itself is developing transdisciplinary research that is better suited to understand the complexity in the field of health. In accordance with said considerations, SALUS makes this paradigm shift come to life by proposing 3 macro strategies. First, curative and restorative actions at every level are coupled with and closely linked to health education and promotion. Second, action should always be intersectoral, transversal, and synergistic. Third, strategies should allow economic benefits to be aligned with the common good. The North Korea project is an exceptionally motivating example concerning the first SALUS strategy. In the early 1970s, Finland had the highest mortal rates from cardiovascular disease in the world. A comprehensive community-based intervention was implemented, involving health services, NGOs, industry, media, and public policy. The result was extraordinary. Levels of population risk factors were significantly reduced. The death rate from cardiovascular diseases in the male population aged between 30 and 64 years declined from 1970 to 1995 by 73% in North Karelia and 65% across Finland. Subsequently, from 1972 to 2014, by 84%. A result that could have stimulated Europe to proceed in the same direction. Today, more than ever, there is a wide scientific documentation on the relationship between lifestyle and health. Let's think, for example, that if Italians ate 30 grams less of processed meat per day, we would avoid 77,000 deaths per year, a good part of which are due to infections. These data were collected from a meta-analysis published in the American Journal of Clinical Nutrition and from a cohort study published in the BMJ in 2017. However, this increase in protein consumption from the animal kingdom that characterized this last century also harms the environment. The Eat Lancet Commission as well documented this relationship. As shown in this graph, there is a strong correlation between meat consumption and greenhouse gas emissions, land use, energy use, acidification potential, and eutrophical potential. Non-communicable diseases account for nearly 90% of all mortality in the World Organization European region. A significant portion of this disease is preventable and depends largely on risk factors such as tobacco use, use of alcohol, unhealthy diet, physical inactivity, air pollution, and exposure to carcinogens and radiation. Better promotion of healthy lifestyles combined with preventive measures to address key disease risk factors have the potential to reduce the prevalence of non-communicable diseases by up to 70%. It is essential to reverse course and generate virtuous circle capable of sowing the health we want to reap. For example, reducing meat consumption would bring multiple benefits to the entire system, from individual benefit to social health benefits, from environmental benefits to animal benefits. Trained and congruent professionals are needed in order to facilitate this transition and move from theory to practice. SALUS proposes to integrate the role of the promoter of health and environmental sustainability as a transversal tool capable of supporting paradigm shift that start from the bottom. The second SALUS strategy moves in this direction and is in line with the recommendation of the WHO Traditional Medicine Strategy 2014-2023, which aims to 1. Help member states harness the potential contribution of complementary and traditional medicine to health, wellness, and person-centered healthcare. 2. Promote the safe and effective use of complementary and traditional medicine through regulation of products, practices, and practitioners. In this perspective, Switzerland in 2009 has integrated complementary medicine into the constitution and has reclaimed the traditional European and Mediterranean medicine that has its roots in the value of lifestyle. Milena teaches this discipline in Italy and Switzerland, and we strongly believe that the European Parliament should be interested in recovering this heritage. The system that regulates individual and environmental health is still heavily influenced by the economic interests of large companies that play a dominant role at an international level. The third SALUS macro strategy rewards those who align economic convenience with the common good. A concrete example of this alignment is the experience of some intentional communities. These realities create local contexts of cohabitation, co-working, solidarity relationships, production at 0 kilometer, greater use of renewable energy, and good practices for the health of the binomial man environment. They are examples of circular economy in a holistic vision, capable of involving multiple aspects of life. These are experiences that want to recreate a condition for healthy longevity, the same that has recorded in some parts of the world since the post-war period. One example above all, that of Okinawa, home of the longest living and healthiest population of the world. I end my speech with a metaphor. Each of us is in our own bathroom. The pot is flooded, and we are busy collecting the water that continues to rise. We are tired, and with buckets and rags, we continue to try to remove the water from the floor that instead continues to rise. At a certain point, something inside of us clicks. We change our point of view. And finally, with dignity and intelligence, we stand up and turn the taps. If we abandon the antagonistic divide et imperat, and we embrace the complementary component collabora model, together we can be the change we want to see in the world. Thank you for listening.
Thank you, Maraska, for your very clear and motivating speech. Now we go to the conclusion of this meeting, and I would like to share some more information about what has been done since 2019 inside the SALUS initiative, and what are the next steps that we are organizing in 2024 and more. And so now I will share another presentation. Okay, so what has been done since 2019? First of all, you know that SALUS initiative organized different areas of activity. The first one is events. So we started, as I already told, an international conference in Brussels in the European Parliament in 2019, but also other two conferences also in the European Parliament in Strasbourg and in Brussels. The last one was in September 2022. And then also other kind of initiative in other countries. First of all, in Italy, because we started here in Italy, so in the April of Milan, but we were also in the Senate, in Italian Senate, in March of this year. And then we went in Spain and Germany, in Switzerland, Czech Republic, and in France. So different conferences organized by SALUS or other member of the SALUS network, but when we had the possibility to explain what SALUS is for us. And then we organize also some InfoSALUS online conferences of high scientific and philosophical level, thanks to the help of the philosophical and scientific committee of SALUS. And we reached a lot of population and also expert in the field of health, sanitary, in the sanitary system, or also in non-sanitary system in a broad sense of health. And also we published some publication like the position paper at the start of SALUS initiative in 1929, in 2019, and then the European Manifesto that we published firstly in 2021, and then we republished now this year with new proposal, and this is the presentation of what are these new proposals that we are carrying on. And also we published with the Lumen Edizioni, that is one of the members of the SALUS network, we published a book on COVID that we translated in Italian, English, and French. And it was a very important work, because we tried to transfer this message of SALUS in the specific experience of COVID. So this is the gathering of a lot of information on what could be done in the pandemic period. And so it was a topic for a lot of InfoSalus, for instance, online conference, and we gather all the information and we create this publication. So it was a message for politicians, especially, of what can be done in a similar experience like the pandemic period. In 2020, we presented a bill for the recognition of intentional and sustainable communities in the Italian Parliament. In the pandemic period, we create an open letter we sent to all the European governments in order to, as I told you, share some information about what can be done in this situation and how health promotion is very important in order to face these difficulties, and not only intervention, sanitary intervention. We need also health promotion, and we are sure that if we share a lot of information about what can be done daily by the population, a lot of problems can be solved without sanitary interventions or strong restrictions like those of the pandemic period. And also on this topic that, as you know, was very strong and pervasive, in 2023, we proposed amendments to the Special Commission on COVID in the European Parliament. And in this, there was a resolution, and out of 8 proposals, 3 have been included in this report of the Special COVID Commission. And of course, the knowledge of a lack of health promotion, the COVID situation, the view of COVID as a systemic problem linked to healthy lifestyles and pollution, they need to coordinate a European health promotion strategy, and we will go to this topic further. So this was an extract of this report. Then we are also involved in research. We started in 2020 with the research with a public hospital in Italy, northern Italy, nearby Turin. And it is a randomized controlled trials in Italy with on the effectiveness of naturopathy for the treatment of migraine. And we are working on creating bridges. The bridge is our logo. We are creating bridges with other networks. And the first one is the TEM Forum network. And we would like to support with the TEM Forum the traditional European medicine that for us it's a very important knowledge and practices that we can use for health promotion. And in Italy, especially, we started with a national coordination on traditional European and Mediterranean medicine that is called CONTEM. So the European Manifesto for Healthy Longevity now is republished, and we launch again to the European MEPs, to the candidates that are running to the European election. And what are the next steps? As you can see in the manifesto, there are 6 action areas. The first one is improve quality of what we eat, promote physical activity, promote deep social relationships, conserve and restore natural environment, promote practices of self-listening and inner growth, and promote an integrated and personalized approach to health promotion that has been presented by Amaraska before. But we have specific proposal to the European Parliament. In the European Manifesto, you can see that we are addressing different levels of politicians, European Parliament, national governments, and also local institutions. But especially for the European Parliament, we have these 6 specific proposals. The first one is start an European Parliament intergroup focusing on health longevity based on health lifestyles and environmental sustainability. This is an evolution of the interest group that we were talking about before at the start of this meeting with Rosa D'Amato and Elisabetta Gualmini. We started this interest group and we are closing this experience of this interest group with these elections, but we would like to restart in a more effective way with an intergroup in the European Parliament that are more stable, a more stable opportunity for a debate between politicians in the European Parliament. Then we would like MEPs to support events in the European Parliament, like in the past, especially on healthy longevity, and to encourage greater European coordination on national health promotion. As Elisabetta Gualmini told before, we know that European Parliament has no competence in health, little competence, not at all, but a very little competence. And this competence rose during the pandemic period in order to face the emergency. But we know that in the EU4Health program, for instance, in the report of COVID Commission, as I told you before, there is space for health promotion, for coordination on health promotion. So it is important to stress this point and to go further on this path, also with the European Parliament, also with the DG Sante of the European Commission. And we ask also to have European standard on the training of health promoters that can combine science and philosophy, as the speech of Amaraska Sparagna underlined, encompassing the knowledge of and practice of traditional medicines. And also, we would like the European Parliament to promote the establishment of a European research center on healthy longevity. And last one, that can be a stimulus for every European nation to establish a minimum percentage of the expenditure in health promotion that we know that are very, very little, usually around 3%, but in this 3% of the sanitary budget, there is a lot of things, not only health promotion as we intended, like promotion of healthy lifestyles, but there is a lot of, for instance, prevention that is more sanitary intervention. So we would like to suggest, and we would like the European Parliament suggest to European nation this investment, the increasing investment in health promotion intervention. Okay, this year we have a plan. Next in this month, we are in May. Okay, in this month we collect signatures support to the manifesto of healthy longevity, and so we are asking candidates in European election to endorse this publication, this document, and we will give visibility to all the candidates that will we will endorse this manifesto. So, and we will share with our network, so we can support all the candidates that want to support SALUS initiative in the next legislation. Then in July, when we will have the new European Parliament, we propose, as I told you before, the activation of an intergroup on healthy longevity. And then in November, the 18th and 19th November, we will be in Rome in the Italian Senate. We organized an international conference on healthy longevity. It is a very important event in an important institution, and we are working in order to create other events in other nations, in other national parliaments, because we know that it is very important to root this initiative also in a national level, because the national level has more competencies on health, and to link the European level to the national level to the local level institutions. And so it's our plan for this year. So thank you so much for your kind attention. As we are telling you in this meeting, a paradigm shift. It's possible and is needed now. Thank you so much, and see you.